Government has constituted empowered groups to look into the various aspects of the management of COVID-19 pandemic. Empowered Group 2 has been formed to address the shortage of items like oxygen cylinders, concentrators, PSA plants, containers, and cryogenic tankers. And joining us today on the show is convener of Empowered Group 2 of Secretaries, Mr. Giridhar Aramane, who's also Secretary of Ministry of Road Transport and Highways. Welcome to Sunset Television, and thank you so much for joining us, sir.
Thank you, Krutiji.
So first and foremost, talking about oxygen, of course, WHO says that 10 to 15% case of COVID-19 require oxygen therapy. Thankfully, as the positivity rate is coming down during the second wave and cases are plummeting, what is your projection on oxygen cylinders, concentrators, and oxygen plants right now, sir?
We have seen a lot of ups and downs in oxygen demand during last 1 year. We started with 900 metric tons in March last year, which went up to 3,000 tons during September. And again, it reached 9,800 during April last week. So like this, we have seen very wide variation in oxygen requirement. We have to be ready with any eventuality because oxygen is life-giving and we cannot deny this basic medical resource to our COVID patients in the country. So government has been trying to ensure that oxygen is available both in the urban as well as rural areas. Ministry of Health and Family Welfare has estimated that we may need around 10 to 11 lakh cylinders in the country to take care of the needs of the COVID patients. So last year, concerted efforts were made to procure large number of oxygen cylinders, and the number went up from 4.5 lakh to 11 lakhs by March this year. And again, we consulted the state governments and asked whether they need more. The result was a demand for around 1.5 lakh cylinders. We have already distributed 1 lakh last year, and this year we are again procuring 1.25 lakh cylinders to be distributed to the states. In addition, under PM CARES, 1.5 lakh cylinders have been sanctioned. They will also be reaching the state governments in next 2.5 month period. These cylinders will be highly useful for rural areas, tier 2 cities, and unreachable tribal areas where the demand for cylinders will be very high, as there will not be any hospitals with the piping system available in these places. Similarly, apart from oxygen cylinders, we may also need to provide oxygen concentrators in rural areas. Because if liquid medical oxygen has to be supplied, we need a perfect logistic chain, supply chain available up to the hospital level. So in places where such supply chain cannot be created, we are planning to provide oxygen concentrators to treat mild and moderate COVID patients. Government has already placed order for 93,000 oxygen concentrators, both with the domestic as well as foreign manufacturers. And incidentally, we are creating very high manufacturing capacity for oxygen concentrators within the country during this process. We are also importing whatever number is required for the hospitals and patients. In addition, Health Ministry has estimated that we may need 1 lakh more oxygen concentrators. We are making efforts to procure them also. These two may not be enough to provide oxygen to the rural patients. So to ensure that patients at the district level, basically tier 2 cities, and also the tier 3 towns, block headquarters, taluk headquarters, we are ordering several PSA machines, that is mini oxygen plants, which can produce and provide oxygen to the COVID patients in smaller towns. Under PM CARES Act, already 162 are under various stages of implementation, installation, commissioning. Another 1,051 have been sanctioned recently out of PM CARES fund, and they will also be installed in next 3 months period. For these plants also, we have created huge domestic capacity so that Make in India dream is also made possible, apart from providing the much needed oxygen to the patients. In this fashion, we have ensured that end-to-end logistics of oxygen supply are tied up within the country.
So that's a very important point that you made. And as you talked about domestic production, so I'd just like to understand what is your assessment of domestic production and import requirements at this juncture and beyond this, beyond the current situation that we are in.
We started off a production of around 6,000 metric tons of oxygen within the country around 1.5 years back. This consisted mainly of industrial oxygen. So steel plants as well as petroleum refineries were mainly using this oxygen, apart from many small industries which were needing liquid medical oxygen. But the capacity was ramped up during last 1 year with the help of the government in the year 2020 itself, in the month of March. So efforts were made to procure large number of cylinders and also increase the capacity of our plants to produce liquid medical oxygen. That's why even when the demand for medical oxygen is 9,000 to 10,000 tons, we
Yes.
are able to allocate and supply to various states. So the capacity went up from around 6,000, 6,500 to, as on today, capacity is 7,300 tons, but actual production has almost reached 10,000, 9,300 tons every day. I have included the production by small units in various towns of the country also. So the domestic liquid medical oxygen capacity today stands around 9,500 to 10,000 metric tons, which was just 6,000 metric tons a few months ago. So this is the amount of capacity creation Government of India has done, and the plants also have shown efficiency by producing 130% of their capacity and not merely at their capacity or 80-90% of the capacity, which is normal practice. This shows amount of coordination between government and the private sector and between the public sector units and the health ministry. The effort made by the empowered group and the various ministries of the government and our leadership is tremendous in terms of motivating all the industrialists to come forward to contribute to this noble cause.
Absolutely, sir. As you said, that India increased capacity utilization of oxygen by almost 130% since August 2020. And also, as far as the cylinders are concerned, supplied more than 1.5 lakh cylinders. How did we ramp up production to this level?
This was a coordinated effort between public sector, private sector, and our top leadership. In fact, you will be surprised to know that Honorable Prime Minister himself interacted with the various industrialists involved in the oxygen production. He spent full 3 hours talking to them, fielding their questions, and assuring them of all types of support which they need to ramp up the production. The MDs of the steel factories, the petroleum sector, all were present in the conference with the Honorable Prime Minister, and he assured that every government department will ensure that the clearances required will be given in no time and the logistics arrangements for evacuating oxygen from their plants will be done in a perfect fashion. That meeting resulted in the increase in production by almost 2,000 metric tons as the motivated industrialists, captains of the industry, brought in capacity expansion and also production much above the rated capacity of their plants. This was the turning point in the entire journey of liquid medical oxygen production in the country. In addition, the departments involved, the DPIIT, the Health Ministry, and various others also have helped. In fact, Power Ministry provided 24 by 7 support to the plants to ensure that there is no shutdown. Each plant has been attached to a joint secretary to monitor their health continuously and ensure that even if a power trips in a plant, it is immediately resumed without any disruption to the supply chain.
But Mr. Armane, the drivers and their vehicles hold the key to meeting the oxygen demand. Now we understand that the investment in the cryogenic tankers, that's massive. How is India meeting that? What are your plans?
This problem also was flagged by Honorable Prime Minister some time ago. The suggestion was to bring in ex-servicemen and the services who have trained drivers, dedicated ones, who are already vaccinated. We lapped up the suggestion. We contacted the ex-servicemen welfare organization, and also we contacted the Skill Development Council, the National Skill Development Corporation, and this chemical industry also has a Skill Development Council. So they helped us in identifying the training program which needs to be utilized for making these drivers compliant with the regulations. So we had a large pool of Hajmat licensed drivers whom we again retrained them for this purpose. We also utilized several heavy truck drivers who can be trained to obtain the Hajmat license. So with the pool of around 2,500 such drivers, now I can say we don't have any dearth of drivers. One factor which we need to consider while looking at the entire operation of liquid medical oxygen supply is that the trucks carrying these containers, oxygen containers, have to move very slow
Yes.
because they contain very volatile kind of a substance. It is essential that they are very, very careful while driving. So the drivers cannot drive more than 40 to 45 kilometers per hour. So this requires a lot of patience. And now with the pandemic, they have to move the oxygen almost 1,000 to 1,500 kilometers. So driving for such long stretches at 40 kilometer speed is going to be very tiresome. So to ensure that the fatigue drivers do not cause any accidents, we have to provide them relief drivers. So we made a regulation that they should have a relief driver who is also licensed. To ensure that we have enough number of drivers, we undertook the driver training program. And now I'm happy to tell you that we don't have any such dearth of trained drivers for the oxygen supply chain.
So that comes as a big breather that there's no dearth of trained drivers. But what about the tankers, sir?
Tankers is another big story. In fact, our capacity was just around 16,000 metric tons
Yes.
in transporting the oxygen. A tanker traveling, for example, say, Angul in Odisha to Karnataka, Bengaluru, will take at least 3 days. Even if we put it on train to reach Bengaluru, it will be taking almost two days. And for decanting there and coming back, it will take another 2 days. So 4 to 5 days is the turnaround time for such tankers, containers. So we have to ensure that we have at least 5 times the daily requirement as the capacity of the containers and tankers. So we had just 16,000 metric ton capacity in the country, which is now less than 2 times the capacity. So we had to make it 30,000 tons. So that was our target, and we got right into it with the help of various government ministries. We primarily took the help of Petroleum Ministry, who have experience in moving volatile liquids for long distances. IOCL contacted various countries, various companies throughout the world. Ministry of External Affairs provided lot of assistance in contacting other countries, manufacturers, and also their diplomatic missions. Work day and night to ensure that we get to know who is having extra tankers, who can give them to us. So ultimately, with the help of MEA, IOCL, we were able to tie up for around 150 containers for leasing purpose. We also at the same time entered into contract to manufacture 100 containers within the country through IOCL. This is in addition to what big industrialists contributed as a kind of a gift to the nation to tackle the pandemic. We received large number of ISO containers as donation from Reliance Industries Limited, Adani Enterprises, and various other philanthropists provided around 150 uh, containers, ISO containers, to transport oxygen to the hospitals. So ultimately, as on today, we are fairly comfortable with regard to the ISO containers. I hope that the number of COVID patients will go down, and the need for such large number of containers also will go down. Although we have the capacity now, I don't want to use them. I want the country to get rid of COVID very quickly.
Absolutely, sir. We are hoping that we get rid of COVID 19 very soon. But as the positivity rate is coming down in several states, the area of concern now is, of course, our villages and also the northeastern states of our country. So, what is the big challenge now supplying necessary medical supplies to these areas?
Recently, in a meeting with the chief ministers and other officers, Honorable Prime Minister clearly pointed out that our surveillance system has to be now reoriented mainly towards the remote areas, rural areas, and hard to reach areas. So, wherever it is difficult to reach, we must now concentrate in terms of the testing and tracking. So, if we are able to increase the number of tests in rural areas, already we are doing many millions of tests. If we can reach out to these difficult to reach areas and increase the number of tests and track the contacts and then treat them,
Yes.
then the rural area problem can be appropriately tackled. Apart from that, our supply chain orientation has also to orient itself towards the rural areas and hilly and tribal areas. We already have identified the areas which require such attention. So we are already in touch with the state governments to ensure that the surveillance mechanism is improved. Recently, we also are in talks with National Health Authority to establish a connection with around 25,000 hospitals in the country to ensure that all the patients who are admitted in their hospitals and their symptoms and the treatment being given to them is appropriately relayed onto the headquarters, that is Delhi National Health Authority's headquarters, so that we get an idea of the spread of the disease
Yes.
very quickly. If every day we get to know how many people are admitted in so and so village, so and so hospital, then it will be easy for us to track their health and ensure that medical supplies reach them in time. As I told you earlier, the cylinders, oxygen concentrators procurement, and establishment of PSA plants in Tier 2 cities is going to help a lot in tackling the pandemic in case it continues to spread in the rural areas.
Right, sir. But talking about another important aspect of our fight against this pandemic, that 150 nitrogen plants would be converted to oxygen plants. That was the plan. What's the latest on repurposing existing nitrogen plants to produce oxygen?
This also we took up on a mission mode. In fact, the first company, UPL in Gujarat, converted its own nitrogen plant to generate oxygen. That was an inspiration to us. So PMO conveyed this incident to us. We immediately lapped up the idea, and the Central Pollution Control Board chairman was tasked to ensure that all the nitrogen plants which can be converted to generate oxygen may be immediately taken up for conversion. So CPCB chairman along with these people have identified around 150 such plants which can be converted to generate oxygen. So far, around 8 have been converted. And the target is in next 2 months, remaining ones are also made to generate oxygen uh, to treat the COVID patients.
But, sir, how was it identifying the industrial units that produce gaseous oxygen of requisite purity that could be tapped for medical purposes?
See, production of liquid medical oxygen requires production of gaseous oxygen. In steel plants, large amounts of gaseous oxygen are produced. A part of which, a small percentage of which, is converted into liquid medical oxygen. So we have several steel plants in the country which, in a regular basis, produce a lot of gaseous oxygen.
Yes.
In addition to that, the petroleum refineries also, many of them produce gaseous oxygen. So we realize that if the number continues to grow, we may have to use gaseous oxygen directly, because establishment of a liquefier will take some time, 8 to
Right.
10 months. We have to buy the plant and then commission it. So that may take some time. So we thought that we will directly use the gaseous oxygen by ensuring that it is of proper purity and proper concentration. So the measures to ensure the purity and concentration are already available at these locations. So around 12 to 13 such locations have been identified in the country. Hajira was the first one to start the use of gaseous oxygen directly for the patients. A piping will be established, piping system will be set up, and a jumbo hospital will be created, say 250 beds or even 1,000 beds in some places. Bina was the next to take off. Kochi is already functioning now. Similarly, in Punjab, in Chhattisgarh, in Odisha, Haryana, we have identified several such locations where these jumbo hospitals are coming up by using gaseous oxygen available there.
All right, sir. Center has been expeditiously supplying oxygen to various states. I'd just like to understand, how do we fix the quota of oxygen for several states and how do we revise them?
It's a consultative process. We are a federal country. The health is a state subject. Center is basically assisting the state governments to tackle the pandemic in a better fashion. So center has been extending both money wise as well as other resources, human resources, medical supplies, etc., to the state government. So the oxygen allotment started with 2, 3 important states, which were the first victims of COVID, like Maharashtra, Gujarat. We spoke to the respective state governments and assessed their demand. They themselves had assessed their demand. We cross-checked with the active number of cases. We had plenty at that time, so we gave them whatever they were requiring at the time. So the process continued for several weeks in the same fashion. Around second week of April, we realized that the requirement is almost reaching the total domestic manufacturing capacity. Then we had to identify some norms to allocate oxygen. And the health ministry came up with some norms for ICU patient, how many liters per minute have to be given, and for a patient not in ICU but on an oxygen bed, how many liters have to be given. These norms were general indication of how much oxygen has to be given, in addition to the infrastructure available in the particular state. If a particular state has got large number of ICU beds, people from other states can also come and take treatment in those hospitals. Major centers like Mumbai, Delhi, Hyderabad, Bengaluru will attract a lot of patients. So there are several factors which went into the allocation of oxygen, but mainly it was a consultative process.
Okay.
State governments took the lead in assessing the demand in their respective states based on various factors and the guidance given by the health ministry.
Sir, as you said that health is a state subject, we also understand that law and order is also a state subject. Black marketing of these goods, that must have been a major challenge. And how did you tackle it?
Black marketing of oxygen cylinders, concentrators, as all of you know, became an epidemic in itself.
Yes.
Some very criminal kind of activities are carried out in this sector by unscrupulous elements. We alerted the state governments. We deployed all our intelligence to ensure that the proper information is passed on to the state governments. We alerted the state governments also to keep a watch on black marketing and also hoarding of medical supplies. We kept on reminding the state governments that medical supplies such as remdesivir,
Yes.
oxygen cylinders, concentrators shall not go into the black market. Wherever it is in center's hand, we took action to ensure that there is no overcharging for these supplies. We made supplies plenty so that black marketing will not have any place in the country. We made oxygen available so easily. We supplied lakhs and lakhs of oxygen cylinders. So there is no dearth of availability. Only when there is a dearth, there is scope for black market. So Government of India's approach has been to increase the supply, at the same time give adequate information to the state governments to ensure that black marketing is tackled at their level.
Sir, lastly, as scientists are saying that this is an unknown, uncharted territory, we don't know the behavior of the virus, the mutations. As they're saying, third wave, fourth wave, fifth wave, we don't know. The world doesn't know. Is India prepared for another wave?
We are taking all possible measures to ensure that we are ready to tackle any other wave of this pandemic. As you have seen, no expert in the world could project daily caseload of 4 lakhs in India.
Yes.
Till second week of April, nobody was even aware that caseload can go so high. The topmost experts also could not say. So, whatever advice is available has been very eagerly taken into account and implemented to ensure that adequate supplies are provided. Again, we are requesting the National Task Force appointed by Supreme Court, as well as our own expert group, Empowered Group number 1, to give us guidance on what we shall be prepared with if a third wave comes. They are at it. They are the topmost experts in the country. Many of them are of international repute also. There are epidemiologists and experts in trauma care who take care of the ICU patients. And there are also virologists in the group. So we expect that an informed decision on what we shall be prepared for will emerge out of the deliberations of this empowered group as well as National Task Force, so that we can be ready with third wave if at all it is going to come. But our effort shall be to maintain discipline and to ensure that we do not fall victim to any wave, whatever wave it is and whatever disease it is. This is my appeal to my countrymen, that we must ensure personal hygiene and proper care of wearing masks and maintaining social distance, not participating in large gatherings in the country.
Absolutely, sir. The onus is on all of us to check the spread of this virus. And as you said, that India is gearing up to counter any unseen situation.